Okay, so I'm going to go over a couple of things in terms of the respiratory system, mostly just the physiology. I feel like the anatomy of the respiratory system is really straightforward. I'll see what I could do about finding some previous videos for that, but I think the respiratory physiology is also one of those things that's a little bit more complicated in understanding. So things you let's go back here. Sorry. Let me just write out a couple of things. So thing you want to understand about the function of the respiratory system is it does respiration. Okay. And remember how respiration included multiple events or things. One of those things is pulmonary ventilation. Pulmonary ventilation essentially means inhaling and exhaling. Okay. The act of inhalation and exhalation brings gases to a respiratory membrane to allow for external respiration. So external respiration is this exchange of gases between the lungs and blood. Then what we're going to use is gas exchange or gas transport to allow us to do internal respiration. So again, internal respiration is the exchange of gases between the inside environments, so between blood and body tissues. So respiration requires all four of these things to essentially to happen, right? So let's look at pulmonary ventilation first. So pulmonary ventilation is the act of inhalation or inspiration, and then the act of exhalation or expiration. And I'm just going to put my picture right there. Okay. In normal, everyday, quiet breathing, inhalation is an active process that essentially is going to require one, muscle contraction. Okay. The muscle that contracts is the diaphragm. It is the main respiratory muscle. What we're going to see is when the diaphragm contracts, the diaphragm flattens. So it gets pushed down. The other muscles are here. These are the external intercostal muscles, just the external intercostals. As the external intercostal muscles contract, what that does is it lifts up here the sternum and actually causes the thoracic cavity to expand. It basically pulls the ribs upwards. Sorry, the dog's barking is distracting me. All this stuff is meant to do one important thing, which is to change the thoracic cavity size. So essentially what that means is the thoracic cavity is going to get larger in size, like, right? This expands outwards, just like that. So as we expand our thoracic cavity out, essentially what's going to happen is pressure decreases, okay? Because the lungs get bigger. This expansion is basically going to mean that as the lungs move outward and like area increases, pressure decreases. Just remember our walls of our room. As we make the walls of the room expand, pressure decreases because it's going to take you a longer time to touch the wall. So pressure inside of the lungs goes down. But pressure outside is, so here pressure goes down. But pressure outside the lungs is going to stay consistent. But in terms of um, changes, since pressure went down internally, that means pressure actually goes up externally. It doesn't actually go up, okay? But when you're comparing the two pressure differences. So since we're going to have our high pressure outside and a low pressure inside, basically air moves into the lungs. That's what's happening. Just remember, right? You're going to think about this as the plunger of your syringe. And as you pull the diaphragm down, it's going to suck air in. That's why it's inhalation. Okay. Remember, as you push the diaphragm down, it's going to push on all the organs in the belly and it's going to push your belly outwards. During exhalation, this is a passive process. So one, all the muscles relax. Okay, so now our diaphragm is going to be curved. The external intercostal muscles all relax. So essentially what that is going to look like is you see how the diaphragm curved or bowed upwards, and all of these muscles here came back together again. So our thoracic cavity ends up being smaller in size. So now we talk about volume. I think it's easier to just talk about area and size. So as the thoracic cavity decreases in size and the lungs are going to actually be filled, essentially what's going to happen is pressure increases. Right? Just think about how pressure is going to increase. I just filled my whole room with people and then I'm going to make my wall smaller. Oh crap, I'm going to hit that pressure. Like there's going to be so much, like so many people bouncing next to the wall and hitting each other that pressure increases. And because pressure increased outside, that means atmospheric pressure on the outside ends up actually decreasing. It doesn't decrease, but because pressure is higher on the inside and you're comparing it to the outside now decreases. So as our increase in pressure inside and we decrease in pressure outside, so I'm just going to write this really simplistically, air moves out of the lungs. Okay, so remember, we're gonna push on our plunger here, right? We're gonna push that direction. Like when you push on the plunger, air is gonna go out of the lungs. So this is normal pulmonary ventilation, just normal pulmonary ventilation. Okay, normal inhale, normal exhale, normal inhale, normal exhale. Okay. So let's then think about like what's gonna happen to like volume changes and a couple different things. All right.